Hello everyone, good afternoon. Thank you very much. I must thank first the entire team of Medical who has arranged such a big platform for everyone to discuss on a critical and very important issue which is radiation protection. Now everyone has seen that we have multiple radiations available in the open environments also, but we don't certainly see the implications of that. What are the harmful effects of radiation, which is very important to understand, to know about the facts behind that and how to protect ourselves from those radiations. So I shall now move on. It's a very first basic question to everyone, if someone would love to answer it, that why do we wear helmets while driving the bikes? Anyone would like to answer why we need a good quality helmet? Either we wear a helmet to just protect our head or just to protect from getting challan from the police. So normally we have seen that people certainly go for it happens to most of the cases that people go with low quality helmets where they just simply escape to get the challan from the police. But we have to look after that. It is our life. We have to face ourselves very sensitively and how we protect ourselves from having a good quality protection for any ways. So moving ahead, surprisingly, we have seen that as of now, only 29% of the healthcare professionals, or I must say the technical staff or supporting staff who are performing different procedures like X-ray or CT, they are not wearing the aprons properly. I don't know how and why they are not taking their life seriously. This is a very, very big thing that we could understand that the data we have taken from Journal of Clinical and Diagnostic Research, which happened in 2021. So out of 200 radiographers, they found that 21% only people are using the proper protection for themselves, which is something which is very critical and we have to look after it very seriously, right? Now, if we see the ionized radiation, what is ionized radiation? So, most of the equipments are there in the open environment or in the hospitals we use like X-ray, CT, MRI, or PET scans, CR machines, which continuously emits MRI during procedures. So there are multiple kind of radiation, which is alpha, beta, or gamma. But alpha and beta are low dense radiation, which can easily be protected from what do you call maybe a paper or any cloth or anything. But gamma rays need a complete protection, for which we have lead, which is available, which has a pp symbol. So lead is something which is very dense, and globally it is been recognized that lead is the most safest metal which can protect from radiation protection. Moving on, that medical equipments emit. So as I already said that we have multiple equipments which emit the radiation, which includes X-ray machines, CR machines, cath labs, CT scan, mammography, PET scan, DEXA, OPG. So a lot of equipments is being used into diagnostic centers and in hospitals. But it is very important that what is the density of that radiation which is emitting by these equipments. That is very important to understand by every healthcare professionals during procedures, and what kind of what do you call protection they need to have. That is very, very important, right? So these are very, very harmful, very critical harmful effects of radiation, starting with the long-term genetic effects are there, then DNA mutation is there, so a lot of cells and tissues being get damaged due to radiation. But it doesn't affect immediately onto your body, whosoever is working on the radiation zone. It gives an impact on a long durations, say another 5 years, 10 years, if you are continuously into radiation zone, then this gives a very bad impact to your body. It can affect your cataracts also, thyroid glands damage is there. If you see tissue damage are there, bone marrow is there, reproductive organs, because if I'm not wrong, I have seen a lot of hospitals having a young supporting staffs, young technicians who are working and performing the activities on those machines actually. But they don't feel any problem because they are so young. They see कि ठीक है आने वाले टाइम में देखा जाएगा, अभी तो चलने दो जैसे चल रहा है. So it is very important for them to understand कि ये इनकी implications क्या है. अगर implications नहीं समझेंगे तो long term में बहुत लंबा नुकसान होने वाला है। रिप्रोडक्टिव ऑर्गन्स में 20 साल का बच्चा है, 18 साल का, 25 साल के टेक्नीशियंस होते हैं, लेकिन उनको अभी समझ नहीं आता। So we have to be very particular that on which equipment we are working, what is the density of radiation it is emitting, and how to protect them. That's very important. So please understand that this cardiovascular immune system damage is there, eye cataract issues are there. So a lot of implications and critical issues being emit because of those radiations. Coming forward, we have a small video which shows how this actually get damaged.
C-arm and cath labs play a crucial role in diagnosis and treatment. However, these devices emit ionizing radiation, posing potential risks to healthcare professionals. These machines release different types of radiation. While alpha and beta rays are less penetrating, gamma rays can deeply penetrate the body, affecting various organs and tissues. When ionizing radiation penetrates the body, it disrupts the delicate balance within our cells. These high-energy rays can directly hit and damage the DNA, our genetic blueprint. Unchecked mutations can result in the transformation of healthy cells into cancerous ones. This process, known as carcinogenesis, is a serious concern for healthcare professionals regularly exposed to ionizing radiation. As mutated cells divide and multiply, they form tumors, compromising the normal functions of surrounding tissues and organs. Ionizing radiation reaches deep into our bodies, affecting even the vital bone marrow, responsible for producing blood cells. The bone marrow contains stem cells, the building blocks of blood cells. Radiation exposure can damage these stem cells, disrupting the delicate balance of blood cell production. As the radiation-induced damage accumulates, the bone marrow struggles to generate enough healthy blood cells. This disruption can lead to conditions like anemia, decreased immunity, and other serious blood disorders. Long-term exposure increases the risk of leukemia, a cancer originating in the bone marrow. Ionizing radiation poses threats to the thyroid, a sensitive gland, which may absorb radioactive iodine, increasing the risk of thyroid disorders and cancer. Eyes are vulnerable too. Radiation exposure can lead to cataracts and other eye conditions, affecting the vision of healthcare professionals. Our skin, the body's largest organ, is not immune. Radiation can cause skin burns, premature aging, and increase the risk of skin cancer, emphasizing the need for robust protection. This is where our commitment comes in.
So I think most of the things get understand what we are trying to communicate to you, that what are the actual harmful effects of these such radiations. If moving on ahead, there are multiple type of radiations, that non-invasive, invasive radiations. Some radiations may produce from radio devices, even from our mobiles, laptops, cell phones, microwaves, but these are invisible radiations which may have less harm effects. But some visible radiations which actually give a huge impact on our body is the machines, the equipment which I have shown you, like cath lab, C-arm or CT scan machines, right? So how it works, that basically it separated the electrons from the atoms, and then the DNA gets damaged, and because of that maybe the cell get dead, maybe the cells or the tissues get dead, and because of that mutation is happening and it causes a big cancer. So people should understand the implication of radiation. That is the only point we are here to communicate, that what are the harmful effects of radiation, and it can cause up to the cancer level also, and there is no cure about it. But we have certain solutions. If we follow the standards, if we follow the guidelines properly, we have the solution with us, wherein we say that LRA as low as reasonably achievable. So we have to see that whatever equipment, whatever machines we are using we have to take care that if we see that as much as low possible, those we can provide, we can give it to the customer and we get the optimal results. This could be the one best solution. The second solution we see is the time. So we have to see that what time is the best to get the actual image, or you can say the diagnosis. If sometime we have seen, I should say rather, or I should not say, but I would say rather, that lot of people I have seen, I have experienced that they are not well qualified in terms of giving the proper doses or operating the equipment. I think sir will better explain later on, right? So they have to see, they have to understand that what doses are optimizing for the particular procedure or particular body part, and this will definitely help to reduce the dose in the overall environment for himself, for the patient and everyone. Coming forward, then distance. So especially because healthcare professionals are continuously into radiation zone, they have to save themselves what are the parameters they have to look after is to particularly distance. So if they keep an optimal distance between the X-ray tube, the focal point where the radiation is coming out, they can keep the effect of radiation dose very minimal to their body particularly. And the shielding, definitely. Every radiation zone or the room where the equipment is being used, it should be properly sealed. So people who are sitting outside or waiting outside or moving outside, they should not get affected with those radiations. So we have multiple solutions available in the market currently where you can get proper shielding for those equipments. Now, see what AERB says and what are their guidelines. If you understand that, it will be very helpful for everyone. That in a whole body, there should be 30 millisievert in a year or in a year and 20 millisievert average over 5 years. As for normal human body like us, because we are moving into those zones not very frequently, once in a year or twice in a year we go, so it has a 1 millisievert per year. But the person who is continuously into those zones, they have to be very particular and they should know. So for that, we recommend that TLD batches should always be there for them. So they can easily measure out what are the doses they are keeping into their body. So to leave 20 millisievert average over 5 years, the if you call off the eyes lens, then it has 150 millisievert in a year. The skin has 500 millisievert in a year. Extremities, then the lower body parts have 500 millisievert. But normally, if you go for the entire whole body and if you are very close to the particular zone, then the effect directly goes to our chest level, to our thyroid level, to eyes and everywhere. So that's why we recommend that proper protection should be there from top to bottom, from head to toe. And for that, we have a complete solution. Now, if we talk of the guidelines for the room and radiation devices. So we have shielding with lead line walls. There should be if the wall thickness is less, then we have to look after that. There should be proper lead shielding. Lead lining should be there. Then we have a protective barriers for the technicians, for the staffs who are continuously into those zones. Because see, if I go to the hospital, it will be one X-ray or two X-ray for me in a day. But the person who is performing might do 50 or 100 procedures in a day. So that's a big difference of number of doses or the radiation, particularly he is actually buying for himself. So he has to see that how to protect from that. So proper lead protection barrier should be there or the curtain should be there. Then we have a area image, restricted area mark or danger zone. So any person coming out or visiting the hospital should know that it has a radiation zone, so he should keep himself away from those zones. Then regulatory radiation level monitors should be there. Yes, because I talked about the TLD batches, they should use it properly. Sometimes, I don't know, if people are using TLD batches also, because that TLD batches should not get ideal in the zone, in the area or at the X-ray machine or any device which emit the. They should keep it separately and always use it whenever they are using any equipment, any procedures. Now, if we see the guidelines particularly, then we have justified procedures. Why we call it justified procedures? Because whenever it is required and it helps to actually diagnose the patient problem, then the procedure should be done, whether it is X-ray for the chest or extremities or abdomen or anything. Pelvis. Most of the time we have seen that people by choice go that I am having some problem, मेरा आप एक्सरे कर लो, ठीक है, भले किसी डॉक्टर ने रिकमेंड किया है या नहीं किया, बट फिर भी वो बोलते हैं कि मेरे को पैर में प्रॉब्लम है, आप एक्सरे कर दीजिए. ऐसा नहीं होना चाहिए. It should be properly advised by the doctor because they know very well when the procedure is required or not required. I have seen, I think mostly in hospitals, 20-30% patients go directly by themselves कि मेरे को ये कराना है. मेरी मदर ने खुद पेट स्कैन कराया, ठीक है, कि उनको लग रहा था कि उनको कुछ प्रॉब्लम है, उनको कराना चाहिए. Which should not be done. No doctor recommended, but we did it. So see the kind of radiation she might get at that time, right? So this is very important that unjustified procedure should not be happened even at professional levels or at personal levels also. Then minimize dose. We already discussed that we should follow as well as reasonably possible, that as much as possible, then the machine should be properly calibrated, it should have a proper dose with itself. So with less dose we can get optimized results. Proper shielding should be there within the room. Then accurate patient positioning. So repeat order should not happen. Sometimes we see that okay we'll do, अब तो CR आ गया है, DR आ गया है, कोई फर्क नहीं पड़ता, 2 सेकंड में आप इमेज को री एक्सपोज कर सकते हैं, you get the results. But ideally it should not happen. If it happens, then unnecessarily the person who is performing or the person who is getting those doses are affected. So that should be avoided as much as possible. Avoiding repeat exposures, protection from pregnant patients. We should be very much particular that pregnant women should not get. अगर हम प्रीवियस स्लाइड में जाएंगे तो उसके अंदर हमने लिखा है कि फॉर द प्रेग्नेंट वुमेन इट शुड बी ओनली 1 मिलीसीवियर ओवर द remainder of pregnancy from the time of declaration. If the declaration has been done after I think 6 weeks until 9 months, there should be only 1 millisievert. So in any case, they have to be very particular that they should not visit any area where the radiation zone is there, and dose tracking with the help of TLD batches. Now coming forward to the solution. What are the solutions now? As we discussed the problems, we discussed the implications, what are the critical issues are there with the radiation, but we see that now we are talking about the latest in radiation protection. So we have observed a little bit about what it was earlier as a protective device and now what currently is being available. So if we see the conventional aprons, they are very heavy and uncomfortable. If you see a single layer apron, which is generally called, 99% of people only know one thing. क्या होता है? लेड एप्रन होता है. अभी लेड एप्रन कैसा है, क्या नहीं है, उसको कुछ नहीं पता, बस उसको पता है लेड एप्रन होता है, राइट? तो बट इसके अंदर भी क्या मटेरियल हम यूज कर रहे हैं, किस तरीके की कॉम्पोजिशंस आ रही है, क्या वो एक्चुअली प्रोटेक्टिव है या नहीं है, वी हैव टू बी वेरी पर्टिकुलर. एंड बिकॉज दे आर वेरी प्रोन टू क्रैक्स, लिमिटेड फ्लेक्सिबिलिटी होती है, इनकी टेंडेंसी होती है, इसको हम बोलते हैं रबर एप्रन्स की तरीके से आता है कि रबर के साथ लेड का मिक्सर कर दिया. अब उसके बाद पता लग रहा है कि उसकी टेंडेंसी वो धीरे धीरे हार्ड हो गया, उसमें क्रैक्स डेवलप होने शुरू हो गए. बट इट इज नॉट सेफ एक्चुअली, वेदर यू वियर इट और यू डोंट वियर इट. फिर तो मैं बोलूंगा वो 29% को भी नहीं पहनना चाहिए अगर वो ऐसे एप्रन पहनते हैं तो. सो वी डिड इट सम स्क्रीनिंग, इसी के साथ है ना वो वीडियो विद दिस आगे. अच्छा, सो एक एप्रन आया था मेरे पास, बहुत पुराना एप्रन है, अनलेबल्ड एप्रन है, जिसको हमने बाई बैक में लिया था. उसके बाद हमने उसकी थोड़ी सी आईडी करने की कोशिश करी. यू सी द रिजल्ट, यू विल बी सरप्राइज टू सी the kind of cracks if you see in this, right, which generally cannot be observed from outer side of the body. बाहर तो फैब्रिक लगा हुआ है, अपने को नहीं पता कि उसके अंदर क्या है, लेकिन जब अंदर से उसको प्रॉपर्ली स्क्रीन करते हैं, then you see the lot of cracks are there. So whether you wear it or you don't wear it is one and the same thing. So 99% लोग क्या करते हैं कि ठीक है लेड एप्रन है, प्रोटेक्शन देगा, अपने पहन लेते हैं, लेकिन उसको उसके बाद नहीं देखते कि वो प्रोटेक्शन दे भी रहा है या नहीं दे रहा है, और उसकी एक्चुअली कॉम्पोजिशन क्या है, वो सेफ है भी या नहीं है. So just we have done the screening also later on. If you see, just a second, इसको play करना है. There is one video.
वो ब्रेक होके डाउन में आ गई ना, पूरा टूट रखा है इसका लीड.
नहीं, ये नीचे कैसे है ये?
अब कैसा है वो तो पता नहीं ना हमें. ये देखो ब्रेक हो गया,
ये पूरा ऐसे, ये सारा नीचे निकल के आ गया. So what I am trying to showcase here that हम जब लेड एप्रन की बात करते हैं कि हम एक लेड एप्रन की प्रोटेक्टिव डिवाइस हम पहन रहे हैं, तो वो कैसा होना चाहिए या कितनी उसकी एफिशिएंसी होनी चाहिए कि वो सही भी है. अब ये एक एप्रन है, मैं एक हॉस्पिटल में गया था, मैं नाम नहीं लूंगा, जहाँ पे पूरा एप्रन अंदर से गिर गया, कट के गिर गया, रबड़ी गिर गई उसकी, कि जो भी हुआ. मैंने उनसे पूछा टेक्नीशियन से कि आप फिर क्या करते, बोले एक की जगह 2 पहन लेते. सर व्हाट इज हैपनिंग, एक की जगह 2 पहन लेते हैं. सो हॉस्पिटल को भी देखना चाहिए कि वो क्या डिवाइस यूज कर रहे हैं, उसकी क्या ठीक भी है या नहीं है. अब एक की जगह टेक्नीशियंस या सपोर्टिंग स्टाफ को तो ये लगता है कि चलो कुछ तो मिल गया पहनने के लिए, बट एक्चुअली इट इज वेरी हार्मफुल फॉर देम. दे हैव टू बी वेरी पर्टिकुलर. अब जब वो आगे फर्दर रिपोर्ट करते हैं मैनेजमेंट में, तो मैनेजमेंट बोलता ठीक है, वी आर टेकिंग सम एप्रोप्रिएट एक्शन, अब करेंगे जब भी हो. एक इसके अंदर नहीं है, आगे है एक और स्क्रीनिंग हमने करी थी यहाँ पे. इफ यू सी द लोकल एप्रन्स, जो सिंगल मेड रबर एप्रन्स बनते हैं, जिसमें एक तरीके से अगर मैं हिंदी में बोलूँ कि व्हाट यू कॉल, आटा और नमक को हमने मिक्स कर दिया, तो क्या यूनिफॉर्म लेवल पे मिक्स हो सकता है? कभी नहीं हो सकता. अगर उसको हम बेलना भी चाहेंगे तो कहीं से थिकनेस ज़्यादा होगी, कहीं थिकनेस कम होगी, जो सॉल्ट की कॉम्पोजिशन है वो कहीं कम है, कहीं ज़्यादा है. एंड दैट इज व्हाट. सर ये कैसे चलेगा? ये आप देखें यहाँ पे स्क्रीनिंग, तो if you see the white spot during screening, that means there is no lead inside it. तो यहाँ पे वो इशू आता है कि जब हम बात करते हैं कि ठीक है हमें सस्ता एप्रन चाहिए, कोई बस प्रोटेक्टिव डिवाइस जस्ट टू फॉर द सेक ऑफ वियरिंग इट वी आर वियरिंग, तो उसके ये रिजल्ट्स आते हैं। अब आप यहाँ देखेंगे अगर उसने 1 साल 2 साल भी इस एप्रन को पहन लिया तो कितनी डोज उसकी बॉडी के अंदर जा चुकी है, जो उनको पता ही नहीं है। जब अंटिल वो स्क्रीनिंग नहीं करेगा तब तक उसको आइडिया नहीं लगेगा कि उसके एप्रन की क्या क्वालिटी है, कितना वो अब तक डोजेज ले चुका है। अगर इफ आई मूव ऑन फर्दर, जो आज की डेट में नई टेक्नोलॉजी आ गई है विच वी कॉल इट द विनाइल टेक्नोलॉजी, विनाइल एप्रन्स वी कॉल इट ओवर रबर एप्रन्स, सो दिस हैज मोर एडवांटेजेस ओवर कन्वेंशनल एप्रन्स। Now you see the screening of this apron. You will not find any single spot in this, which declares that at least you are getting good safety and 100% protection from any device whichever you are using, irrespective of distance or dose. Yes, definitely dose also matters, that which equipment is emitting which. अभी कैथ लैब की बात करेंगे तो वो ज़्यादा रेडिएशन प्रोड्यूस करता है, सियाम थोड़ा और कम, एक्सरे और कम। तो ये जो डिस्टेंस है और जो टाइम की हम बात करते हैं वहाँ पे ये एप्रन्स काफ़ी इफेक्टिवली काम करते हैं। And these aprons should be well screened every after 6 to 8 months by each and every clinic, hospital, anywhere wherever they are using it. कोई भी ब्रांड यूज करे, कोई भी प्रोडक्ट यूज करे, डजंट मैटर, बट ये स्क्रीनिंग होनी चाहिए सबके साथ। So just we are trying to showcase that what are the difference between conventional and over the new technology of vinyl aprons which are available in the market. Now these are some metals which, as lead is always there, which has the highest protection level compared to any other metal, but yes, we have other substitutes also available in the market, tungsten, bismuth, antimony, some other are also there, but these are being used as of now to give a lightweight and good quality aprons protections to any healthcare professional, whether it is a doctor or a technical staff or supporting staff. Sorry. Okay. So the latest technology is superior to rubber lead, as we have already seen the result between the conventional and non-conventional latest technology available. It gives much lighter weight, more flexibility, easy to clean, crack free. सबसे बड़ी बात है crack free, that these are non-tearable sheets. Non-tearable sheet से क्या होता है कि अगर हम बाई चांस, कई बार हम देखते हैं कि डॉक्टर ने फ्रस्ट्रेशन में आके एकदम से एप्रन उतारा और जमीन पे फेंक के चले गए, जब वो लॉन्ग प्रोसीजर्स करते हैं तो जनरली ऐसा होता है, राइट? या फिर टेक्नीशियंस प्रॉपर्ली केयर नहीं करते। तो नॉन टेरेबल शीट के साथ कम से कम ये फायदा रहता है कि ये इजीली क्रैक नहीं होते हैं, ये हार्ड नहीं होते हैं, इनके अंदर फ्लेक्सिबिलिटी इतनी बनी रहती है, लॉन्गर ड्यूरेशन होता है। So sometimes we do the flex cycles also. Flex cycles declares that how many times you can fold and unfold the apron. So we have a lab testing available with us, that 5 leg flex cycle, 3 leg flex cycle, 1 leg flex cycles, so which somehow helps us to understand the actual durability of the product and whether we should use it or not use it. Moving ahead, choosing the right apron, that what AARC claims that 0.25 should be the minimum protective apron device should be used. That depends on the distance of the equipment. If you are using a cath lab, if you are using CM or X-ray, if you are close to 1 meter with the primary dose, it should be minimum 0.5 mm should be there. If we are away 1 meter of dose, then 0.25 is also suffice. But depending on that how frequently is coming and closing to that radiation unit, particularly X-ray tube. So if you talk of whole device, as I said, that from top to bottom it should be protected, then head cap, goggles, thyroid, all are available, it should be properly used. Even for CM and cath labs, because sometimes their procedures are long, they are very close, people are very, doctors and technicians are very close to the tube area, so they should get minimum 0.5 mm protection apron, they should use it. Now, radiation protection accessories, as I said, from top to bottom, we have head caps, goggles, thyroid, the entire body, frontal body and back and front body aprons, then gonad and ovarians are there, even leg protection are there, leg glasses are there, which they generally should keep it always, curtains are there, which are being used in cath labs. So all these devices should be used when we are doing, depending on the equipment which is being used. It's a short video about DHAAL, what we are and what all product range we generally provide along with the certifications and product range. Can you please play this? I think that's all for now from my side. Thank you very much. If anyone has any query, please let me know. Yeah? Or I hand over the session for further talk. Thank you very much. Have a good day.